21st of September, and we are in Anaheim, California, and we're here today for the CBD Health and Wellness Expo, helping people educate to medicate. We're here, we'd like to meet some people with the Mace outfit. We're also here people with the Cannon Wire News, and let's go and see who we meet today.
100% of the cannabinoids are diet.
It's a little different because I've been in practice. I practiced in Europe for 5 years and then practiced in Canada for the last. Down to the definition, I find people are asking me, what is the difference between THC and CBD? For most of your career, what piqued your interest about CBD, and what are you finding? How is it helping your patients?
So some of the interest was piqued from my personal experience and how it helped me, and then some of it also was inspired. So given that CBD can help modulate that stress response, that ties into how we use that to help some of the people who are not able to necessarily get the kind of outcomes that we would like if we're just strictly working on thyroid function or just strictly working by helping to modulate the stress response using CBD, then their body's own production of some of those hormones goes up, the balance in those hormones evens out,
and then finally, you also work with a lot of athletes. Where do you see this going in terms of the NFL, the NHL, maybe side effects? And what about the testing? Because that's a question I get a lot from my athlete friends.
Yeah. So the World Anti-Doping Agency removed CBD from the prohibited list starting in January of this year, but THC is still banned. And so one of the things for professional athletes, obviously in particular, but any athlete that's in any field with CBD, other tests will actually differentiate that out, and then you can tell, okay, well, this is just CBD in the system, and it's not the THC-based positive on that test.
Do you know of any of the major sports that are like using it right now? Doctors
using tests?
Are using CBD for their players.
So in the professional realm, I am not working with any professional athletes myself. I work with lots of other recreational athletes.
Saving lives. Kind of the same kind of question. How did you get turned on to CBD, and are you finding it replacing certain methods that you use?
First off, let me tell you, I was an anesthesiologist for 30 plus years. I call it the legalized drug pusher, best of them all. But when I retired from anesthesia, I was invited to one of the cannabinoid clinics to write cards, and I had my preconceived notions of who those people were going to look like, and was surprised because they weren't, drug-looking, seeking people. They were that 55 age group and above, grandparents, retired doctors and lawyers and bankers, and they really were coming to get off opioids and the multiple pages of pharmaceutical drugs. Looking at the cannabinoid system is adjusting and readjusting to keep your body at homeostasis. So every physiological system is working in harmony. And when that system is not in harmony, that's when we see disease processes. And so not only did I see that as a consumer, but as a healthcare provider, I felt cheated out of some knowledge. Because even as an anesthesiologist, I can tell you that I could have used some component, in particular CBD, to help my patients both preoperatively and postoperatively. Talking about decreasing inflammation, I would have put patients on it a week before surgery to not only decrease inflammation, but to decrease post-op pain and their post-op need for opiates. So it really was mind-blowing to me, made me angry, but at the same time stirred the scientists in me to learn more and more about it.
You're also really involved in the cannabinoid group.
Yes, I am.
Can you walk us through that?
Yeah.
It's very impressive.
Okay. My family and I, 2 daughters who are physicians, and my husband here, we all do what we call cannabinoid therapeutics. And what we do in our clinics, the American Cannabinoid Clinics, we apply the science of cannabis to that very complex physiology of the endocannabinoid system. So we call it cannabinology, the science of anything that has cannabinoid-like properties that we can apply to the study of the ECS, which we call endocannabinology. And once you understand how that system works, then we can better sort of figure out which cannabinoids work best for which diseases. including cancer. Because there was years and years before they thought that the cannabis worked sort of indiscriminately on cell membranes. But with the research and understanding the ECS, we now know that it targets certain receptor depression. So you get the opioids and cannabis working synergistically. So as we increase cannabinoid use, we can come down on the opiates. And that's because the cannabis product CBD also works to increase those endorphins in your body. So it stimulates those endorphin receptors to produce your own endorphins. So we can come down off the opiates this way and go up on the cannabinoids. And so they're working synergistically, not to depress a patient, but synergistically to get a better outcome.
Thank you very much. Very informative. And Dr. Knox,
We're able to have a conversation with them. As far as the use of the cannabinoids in the emergency room, I would have to say it just doesn't really exist at this point. CBD is really more long-term therapy, therapeutic goals, and in the emergency room we're always really focused on acute problems. What are we going to do? They're in the emergency room today because they've got an acute exacerbation of that pain. We can give you a shot of morphine or whatever, and kind of alleviate that pain immediately. But then what do? You up your dose of opiates, or you add an anti-inflammatory or a muscle relaxant or a neuroleptic like gabapentin, all the usual pharmaceutical things. But really, I look at now I've got another tool that I know about. How many people are just using it optimally. That's the big question. CBD product, for his chronic pain issues, he was getting great results. No side effects whatsoever. Little on-the-job injury, gets a direct test, and he's positive for THC because, again, legal limit 0.3% THC. It's a CBD legal product. You can use it, no effect, but you get a positive test. So those are more the kind of questions. If I had a guy had stage 4 lung cancer, he had pleuritic pain, because it metastasized to the surface of his lung. So it's like, horror pleurisy. He was on high dose opiates, couldn't get pain control. Now you can say, add the cannabinoids, and have a much more, effective result. So.
and finally, so what I asked earlier, application process, is it just depend on the patient's needs, or do you have a preference on, obviously topicals are more for pain and joint arthritis, tinctures, but do you have a preference with the guy who had the lung problem? What did he do?
Yeah, well, hopefully we got him on usually oils or tinctures, or where we start, and just, it's not a situation where you want to do a lot of inhalation,
Right.
And then it's it's a deep structure problem where the topicals don't really reach. But again, it depends on the medical problem, and we kind of call it a layered approach. Okay, if you got arthritic pain, you've got even peripheral neuropathy, and I'm still astounded with that one. It's a nerve problem. People that get relief with topical products is astounding. Topical alone, that's all I need for that peripheral neuropathy that was making my feet feel crazy. So that's a first layer. We like oils and tinctures. I kind of put them in the same. It's just the oils are often more concentrated. Tinctures have been a little more diluted, but take them sublingually. Rub them in the gum line, nasal septum. Those approaches. It's I think the one way we prefer, because it's a little more measurable. As far as the dose you're getting, so you can judge your response and make adjustments in how much they're using. Fairly quick in onset, but it lasts longer than inhalation.
And finally, so what I asked earlier, application process, is it just depend on the patient's needs, or do you have a preference on, obviously topicals are more for pain and joint arthritis, tinctures, but do you have a preference with the guy who had the lung problem? What did he do?
Yeah, well, hopefully we got him on usually oils or tinctures or where we start, and just, it's not a situation where you want to do a lot of inhalation,
Right.
I think the one way we prefer, because it's a little more measurable as far as the dose you're getting, so you can, you're not getting, too intoxicated with them. At least at this point, vaping is a little safer than smoking. Not that there's big risk, but either way it can cause airway irritation with cough, even though we don't see the long-term, COPD and cancers and stuff you do with tobacco. The mantra is, you start low and you go slow. There's a lot of medications, that nanoparticles and things, you can get a little more systemic absorption from
The products that you ingest have to go through your gut to be processed and through your liver to go through your system, whether the water soluble or don't have to go through that process. Is that true or not?
I will tell you the cannabinoids are all lipophilic, so they do better in oil. And if a patient is going to ingest the cannabinoids and we want quick ingestion, we'll have them take something like an oil product, so it absolutely increases absorption rate. So it's probably better in an oil.
No, it is oil, but it's
Yeah.
water soluble. That's what they're marketed as.
Oh, what,
Yeah.
what I see there may be
They claim
partially,
that it's 85% absorption rate, which nobody can claim for that. That's what they're marketing it as.
Yeah,
I think part of it is sometimes a homogenization factor. So if they do have a lower concentration oil in something, you don't want all that oil, like salad dressing, right? You don't want the oil
Right.
in very high concentration.
It
One part.
doesn't separate.
Yeah, exactly, right. So as far as I understand, the water soluble is a component that's making it more homogeneous throughout, and therefore delivering a more consistent dose through it.
Okay.
I'm not sure it's affecting the
Their
actual
reasoning
absorption
is-
rate.
Yeah, their reasoning is that 100% of the cannabinoids are body because they go through the digestive system.
portal system. Because the liver's responsible for really metabolizing everything you eat. So all the cannabinoids are metabolized in the liver. Inhale it or take it otherwise, it gradually goes through the liver. Everything's going through the liver first. So that, causes a metabolic, because the first metabolic byproduct of delta-9 THC, much more affinity to those CB1 receptors. So that's what is, you brain 2 hours down the line getting hit with this flood of 11-hydroxy, now you are couch lock stoned, P450 system in the liver, responsible for metabolism. You got to realize it's responsible for metabolizing 60% of your other pharmaceutical drugs. So that can have a big effect on you as well. So.
Okay, so add on to that question.